Hey everybody, this is Stephanie, and I'm so excited to be here today for a behind the scenes interview. Yay! Katie Keats May is in the house. I'm really excited to hear about your work with teens and accelerated resolution therapy. So,
Yeah.
for anyone who doesn't know you, can you give just a little snapshot? I know that's like a huge ask. Who are you? Tell us about the work you do. Have you been writing anything interesting lately? All that.
What a setup.
Right,
Yeah.
I
So
know.
thank you for the invitation. I'm psyched to be here and talk about intensives and ART and all the things. It's something that I've been so jazzed about lately. But backing up and just introducing myself, thank you for the invitation. My name is Katie K. May. I'm a licensed professional counselor in the state of Pennsylvania. I own a group practice. We have two locations and a team of 18 to 20 at any given time where we support high-risk teens, mostly those with self-harm, suicidal behaviors, also eating disorders, OCD, anxiety, depression, like all the teen things, but basically those that are high acuity, and we keep them in their lives and help them learn to be skillful. And we teach their parents how to support them in the process too. And so that's what I do in my real life every day. And then I also do online consulting, and I have a consulting practice where I support other therapists with running groups and developing their group practice. And I also recently published a book for parents of teens, and I'm working on a second book that outlines my framework from this book, but from the therapist perspective, so they can deliver that
Ooh.
treatment. Was that enough? Did I cover
Oh, that's
everything?
amazing. That's amazing. And thank you for finding time for us. So, for anybody who's watching, I saw, like, I follow you on socials and I saw your post about intensives for school avoidance.
Yes.
And I was like, ooh, we need to hear more about this.
Yeah.
Um, so, of course, it was the start of the school year. When we're recording this, it's like whatever, it's
It's
October
October
1st.
1st. Yeah.
Yes. So, I'm sure that a lot of families and teens have been dealing with that for a number of reasons. So tell us a little bit about what you offer and maybe back up before that. Like, what were you seeing that caused you to think, maybe we should be doing something a little bit different than just like the standard week to week kind of deal?
Yeah. So the story actually starts as very personal. I have a teenager who is now 16, and they went through 2.5 to 3 years of school avoidance. It
Ugh.
was one of the hardest things that I've ever experienced as a parent. And so, like, I, as a teen, struggled with depression, self-harm, all the things. So I was like, of course, my child is going to experience some kind of depression, ADHD brain, all those things. I was prepared, but I was not prepared for school avoidance. And so
It's
this
so brutal
thing that
too.
disrupted my life, it's so difficult. It's so unpredictable. It's so disruptive. Of course, there's this child who's struggling. So that's at the center of it. And I don't want to lose sight of that. But as a parent, I was so out of my element. And we navigated it together. My child is doing really well, junior year, about to test for their driver's license tomorrow. So we're on the path to, moving towards bigger and better things. And in this process, I recognized that there was this huge gap in how we're treating school avoidance, because what's happening is the school has very little support to give. All they can do is say, like, come to school, or eventually you'll get a truancy letter, or we'll evaluate for an IEP if you push hard enough for us to do that.
Mhm.
And therapists weren't really, at least my therapist had ideas for how to work on this, but not necessarily like a full framework for what was going to work for this population. So that's kind of
Yeah.
like all of my starting point that led me to thinking about how do we create a system that supports families in getting students back to school, but also in stabilizing their mental health and improving their communication and family systems in the process.
Oh my gosh. I love it so much. And in private practice, I had a client dealing with that, and it was so difficult. Even if we have parent involvement and school involvement and there's a team, it's still hard
Mhm.
to feel like you're making any
Yes,
progress or just giving them relief. So I love this.
right.
What does the intensive look like?
Yes, and I was telling you a little bit before we started that it can look different, but there is a typical structure, and we always start with an assessment. So for any of our clients, we're doing a biopsychosocial assessment, and that's about an hour. Prior to that assessment, we've done some screeners. So we have a general sense of what does depression look like? What does anxiety look like? Has there been a trauma? Things like that we've already kind of screened for and continue to screen for in the process. So we really want to, on the front end, get to the root of what is driving the school avoidance. And I want to give you some examples of what it could be before I tell you what it looks like intensive style after that. Because
Hmm.
sometimes what we uncover in our screening process is that there's underlying neurodivergence that has not been diagnosed. And we do ADHD testing. So we'll follow that thread and that process then where we'll do ADHD testing, we'll do a sensory profile, we'll support the family in advocating for an IEP. And when it goes that route, it's less clinical intensive and more assessment and then helping the family advocate for what the environmental needs might be at the school. So that's like one
Sure.
route it could take.
Yeah.
Another route it could take is bullying or some kind of performance anxiety at school or social anxiety, something that falls into that anxiety or trauma category. And when that's
Mhm.
the case, then we move into our accelerated resolution therapy track and we support in an intensive model that way.
So cool. Is there a set time frame that you prefer to utilize? If folks come in, I mean, you can tell us either one, but if folks come in and
Yeah.
you're like, okay, this is definitely like a more of an anxiety trauma kind of case.
Yeah. So the way the process looks, and that's why I said we can do it different ways. I typically like to do assessment and then first ART session all at that first meeting. Because what I know to be true is that people are struggling so much when they're dealing with this school avoidance that why don't we just get them some relief right on the front end? So if we can
Mhm.
uncover what is driving or contributing to the school avoidance and then take that edge off right away with the first hour intake, 90-minute ART session all in one, then
Ooh.
we've had some clients that have gone to school the next day, and then that's it, and then we're done. Our average metric has been 2 weeks of getting clients back to school in this program, and that 2 weeks looks like ART session Monday, Wednesday, Friday, 3 sessions. Monday, Wednesday, 1 week, Monday the next week. So really, we chunk it into 90-minute sessions, and we at the end of each session, like 3 days after that session, we're taking another screener. Has your panic attack
Hmm.
frequency gone down? Have your anxiety symptoms gone down? Has your trauma symptoms gone down? So we're getting a sense objectively with the screener. I guess that's still subjective, but with the screener. And
Yeah.
then we're also meeting with them and getting a sense of what's different behaviorally. Have you tried to get out of bed? Have you made it to the door rather than staying in bed? So we're assessing for progress and then we're taking the next session and we're addressing what needs to come next to get them back to school.
Oh, I love that. So it sounds like 90 minutes, Monday, Tuesday, Wednesday, and usually it's about 2 weeks. Did I hear that right?
It's about 2 weeks. It is. I think my internet's unstable. I hope we're good.
Oh,
It is about 2 weeks. I would say that I like, you're good? Okay.
yeah.
I would like to do it in a shorter time period. I like to do it in maybe 1 week if the family can. And another reason that I like to do it in a shorter time period is because I can, as a therapist, write an absence note to say that client was seen for 3 hours during the school day today, and that supports them in not hitting that truancy mark, right? So I learned a lot
Right.
going through this process about what qualifies as towards truancy or not. So that's a really supportive way to help the client while they're getting treatment and they're working on getting back to school, not working against them by increasing that tension of like this next step is going to be more catastrophic for our family.
Yeah. Can you tell us a little bit about like clinically what types of things you're focusing on during those intensives?
Yeah,
I mean,
so
it
there's a
probably
couple
depends for everybody is different.
It is, but we still follow a similar framework. And there's a couple modalities that we're always using. So we are using accelerated resolution therapy on the front end. And what I can share about that, because there's some things I'm not allowed to share about that, but it is an eye movement based therapy or bilateral stimulation. And the targets that we'd be focused on are either a typical day of what it's like when somebody gets up to getting to school or what it's like getting them through the school day. And whatever their target is, maybe it is social anxiety. So they're afraid of other people's judgment or afraid to speak up in class, or maybe it's that they've had a past experience of bullying. And so when they walk into math class, they start to get really panicky or have intrusive symptoms because it reminds them of last year when this bully poured water on their head or something like that.
Yeah.
So those are the kinds of things that we're working on in accelerated resolution therapy. And we really work on like cognitive rescripting, imagery rescripting, as well as calming the body symptoms down using bilateral stimulation. And then there's like a second end to that that typically happens after the intensive and 2 week period where they're doing more exposure and response prevention type therapy, where they're working with a therapist to build a hierarchy of how can I get back to school? If I haven't already gotten back to school, how can I behaviorally work towards getting back to school? Maybe it's going to visit for an hour, maybe it's sitting in the library and really working their way up to a full day.
Hmm.
And then there's a third piece of working with the parent. So it's interesting, there are some families where we're not only doing the accelerated resolution therapy with the client, but we're also doing a session or two with the parent. And I can speak to this, as I've told you, how stressful it is that there's this like doom of I'm helpless. I can't get my child to school. Am I going to lose my job? I have to cancel my meeting. Like there's just a lot of stress. And so when we
Hmm.
can calm the parent system down, they can be more effective in the process rather than being so like stressed and frazzled and like validly so, but it doesn't lend to success in the morning when a parent is so stressed and the tension is that high.
That makes so much sense because when you're stressed as a parent, it's so hard to like show up and do whatever the plan is or like the intervention. Wow. I love it. So here's my brain. If teens, young adults are
Right.
struggling to get to school,
Mhm.
how do they feel about coming in for the intensive?
I mean, big sigh, that's a big question. But for the
Right.
most part, they want to be in school. And that's why I said it really does fall into these different categories because there is this category of I am a neurodivergent individual who doesn't fit into the box of a typical school system. And then
Hmm.
we're working with the family in helping them affirm who that person is, who the individual is, and what environment is going to be the best fit for them. So
Yeah.
that for them, it's not necessarily like, I don't want to be at school. It's more like my body is screaming at me that this school is not a good fit for who I am. And so,
Yeah.
and then we might also do some ART work with the parent on grieving, like my child's path looks different than I expected it to, and I need to work through my own stuff on that so I can be a support for them.
Wow.
But I would say the majority of the clients that come in want to be in school, and I've heard that again and again, like, Mom, I want not just my kid, but in general, like parents reporting, Mom, I want to go to school, but my anxiety gets in the way, or like I can't make myself do it no matter how much I want to be there. And so for those folks, I think we see a lot of success because the motivation to get back to school is there. It's just that their mental health has gotten in the way of that.
Hmm. Hmm. Yeah. Oh my gosh, I love it. So, are you seeing a lot of people like opting for this option, to do the intensive? I mean, obviously there's a lot of stress and urgency, I would imagine, when there's something going on like school refusal.
Yeah, I'm going to separate your question into two parts. The first part being like urgency and stress are the bread and butter of my business. Like when your kid wants to kill themselves or they're not going to school, we are the place that you go. And that is, for me, has been a very fruitful business model, but also the place where my heart lies. And so it really aligns on both sides for me. And then are we seeing a lot of it? Yes, but seasonally. So I would say it ramped up in August. We saw all the anxious kids in August. And then we're seeing a few trickle in now. So we're in the Philadelphia area. Once November hits, daylight savings time hits, and it gets dark at 5 o'clock, everyone is depressed and nobody wants to go
Mhm.
to school. And so we'll see it ramp up even more. And then kind of around like before the end of the year, March, April-ish, when all of the kids who were like, yes, this is my year, it's going to be different, I'm going to do great. And then that just falls apart. Then we start to
Uh-huh.
see those kids. So we see spikes. It's not a consistent referral source, but that's okay. We see spikes of it. And then the other part is that we need to have enough space in our schedule to accommodate it. So we just know those seasonal periods and plan for having people who are willing to do intensives at that time. My entire team is trained in ART, and that was something that was really important to me to put us all through that training because I see it as such a game changer, and I needed anyone to be ready to do this work because at first it was just me, and then it was more than I could do by myself. So I was like, y'all need to get trained so we
Yeah.
can all do this thing.
That's incredible. Just from like what you can offer to the community, but like the knowledge you share as a team,
Yeah,
that's, I love it. Wow. Okay, my brain's going so many ways.
I'm ready. Do
I
it.
also want to say if there's people here live and you have questions, feel free to drop it in the chat and we'll do that too. Um, I think when you were talking about urgency and stress and risk, it made me think, do you have any are there any scenarios under which you'd be like, "Oh, I don't think an intensive's probably the right fit. It's not clinically appropriate." Because that looks so different for all of us. Where's that line kind of in your work?
The line in my work for these intensives would be someone that I think that they're presenting concerns or the contributing factors of them not going to school is not going to be resolved by accelerated resolution therapy. And I can talk about that. But I mean, that's why screening is so important to me. And so we say that in order to qualify for the ART portion of the program, you have to have either clinically significant anxiety, panic disorder, or trauma.
Hmm.
And social anxiety, we're adding into that inclusion criteria as well. And yes, accelerated resolution therapy is evidence-based for depression, and there's some clinical support for like things like eating disorders and OCD. Our team doesn't have the bank of outcomes to be able to say that this is something that is going to be the right fit to move forward in this model. And part of that is because I'm so careful. Most of the families that come to our center have been through a revolving door of hospitalization, suicide attempts, 6 to 10 therapists. And I don't want to overpromise on hope in a way that makes them even less willing to approach treatment in the future.
Hmm.
So we might offer the same modalities, but not in that intensive model that kind of implies or suggests to the family like the intensive model is going to get your kid back to school sooner. And if we can see that it's not going to be that case, then we're not going to offer it because we don't want to offer hope that isn't necessarily immediately available to them.
Yeah, yeah. Oh, I appreciate that so much. And so it's kind of based on like the diagnoses, like here are the
Yeah,
ones we know, like we have success with, and here are the ones that are like, you know, outside the scope or just not what the intensive itself focuses on.
exactly, exactly.
Yeah.
And I saw someone ask what's a good ART training that you recommend. I feel like I should get paid for how much I talk about ART, but I don't. I just love it and believe in it. But there is only one training company. It's acceleratedresolutiontherapy.com. If you go, you can see all of the trainings that are listed throughout everywhere. They offer them in all different places. A lot of people have reached out to me recently asking about it. So I've been trying to connect those people because if you have 9 people in an area, they'll bring a training to you. And that's generally what I do and bring them to me in the Philly area.
Yeah, yeah, that's great. And it works so well. I mean, in the intensive format, right? Like it's so effective. Um,
Yes.
can you tell us a little bit of like what kind of transformations you've seen?
Yeah, well, and so typically they say that ART works in 1 to 5 sessions, and I've seen that to be true for a single incident, a trauma, a target of some sort. And I've also seen adults who have had complex trauma, and I've seen maybe like around 7 sessions, and they were like, "I'm good, I'll see you later."
Right.
So it does work really fast. What was your question around? Oh, the kinds of outcomes that we've seen. So
Hmm.
we've seen for single incident trauma, one session, and then not meeting criteria for PTSD. We've seen 50% reduction in PHQ scores for depression after one session, cessation of panic attacks after one session, reductions in grief and caregiver stress after one session. We typically recommend a course of 3 to 5 because inevitably, and I'll give you an example. So we've had clients come in who say, like, my eating disorder thoughts are really strong. So we help quiet them down. And then, no, wait, I'm going to flip it the other way. They're really upset about, like a teen thing that happened. They're a parent, they come in and they're like, oh, this thing happened and I'm upset about it. And so we work on that. We work on maybe like the trauma of their child being hospitalized. And
Hmm.
then once that's uncovered, then their own stuff starts coming up, family of origin stuff, their own anxiety, depression, their own eating disorder symptoms. And so then we're able to uncover another layer.
Hmm. Hmm.
So we typically recommend 3 to 5, but I have seen a lot of sessions where it's one and done and people feel good and they're ready to go back into the world. And that's why the word intensive feels a little funny to me because sometimes that intensive is like 90 minutes after an intake, but I guess that still qualifies, right? Like
Oh
that's
yes,
good.
definitely.
Okay.
I'm like there's no definition. And if you think about it, the intake, if that's 90 minutes or an hour and then you have another 90 minutes, I mean that's still like a 3 hour um appointment. So
Right. Right.
absolutely. And I think like if people can have such rapid results, then oh my
Why
gosh,
keep
let's
them
do
longer?
it. Yeah.
Yeah. Um,
Exactly. I think you had a question in the chat that was about the length of time.
Length of time. So typically what I do, we always do a 60-minute, 45, 60-minute intake again because I want to get really clear on what the targets are. And I know there's like I have a friend who's an EMDR therapist who does intensives and she's like, I do that, all that in like an intake form. And I know you can do it that way. I think
Mhm.
maybe it's just the way that my brain works is like I like to see people's affect when they report something. I like to understand what they mean by the words. All of that is like do do do. It's like all the data that I use to
Yeah.
help figure out what the target is. So that's why I like to do that in person. I always schedule the first ART session for 90 minutes because you don't know how fast somebody is going to process. There
Mhm.
are some people that are like very granular thinkers and they have so much to wade through that if I only had a regular session time, I'd be rushing or having to contain at the end of it. So I
Mhm.
always schedule the first one for 90 minutes and then I can adjust from there. And if I see that they're a fast processor, especially kids and teens are faster processors, so then I might say like our next session only needs to be a regular 45, 60-minute session. Or I might want to spend another 90 minutes. I've done 2 hours, but I've never actually, like I've blocked 2 hours and I've never actually hit that 2 hour mark with ART.
Yeah.
But with adults, I could definitely make use of 90 minutes and add other things in if it made sense for them.
Yeah, I love it. Oh, that's so great. And I love the format that you talked about earlier, specifically for the teens and school refusal of doing it like, I mean, they're not in school. So doing
Right,
like multiple days in a row, reassess after that week, and then if
exactly.
you need to like continue again, reassess. Um,
Exactly. I've done
which is
two
brilliant.
sessions with one person in a day. So another model that and again, I've like piloted this a couple different ways as I've tried to figure out what works for me and my energy levels. So I've done intake in the morning, ART session, take a break for lunch, come back, do another ART session. And I think that it could work. We've done it if
Mhm.
people, like I've had people travel to us from another state. And so I would do it for that reason. But I think as an only way to do intensives for me and my energy levels, like I felt tired. I also noticed the client yawning a lot at the end. And so it's just,
Mhm.
and oftentimes if I have the space, I would offer that to one of my clients, like, you know what, I have the next hour. Do you want to do another block? And they usually decline. And I don't know if that's just because I gave them an option and they're 16 or if it's because like
Right, right.
levels, but I just think it can be a lot. It can be taxing. And so that's why I try and space it out at least one a day or, again, Monday, Wednesday, Friday, like every other day is typically what we're doing. And
Hmm.
and that's
Hmm.
also because they need transportation. There's a lot of other pieces to navigate when we're working with teens.
Yeah, yeah. Oh, that's awesome. Let me see if we have any other questions coming in. Keep them coming. Um, I'm curious, you talked about doing some of the ART with parents around their own stress. Are
Mhm.
there any other, or I should say, where along the way, like what does parent involvement look like in the teen intensives?
Yeah, so it's such an important part of the process for any of the work that we do because teens live at home with their parents, and the environment is such a powerful piece of changing teen behavior. But specifically for school avoidance, we strongly recommend that they do at least one ART session. And we also do a model of treatment called SPACE, which I always butcher,
Hmm.
supportive parenting for anxious childhood emotions. I got it. Okay.
Yeah, that was awesome.
I always forget it. I'm like, it's this anxiety avoiding thing that we do that I don't personally do. That's why I forget the acronym. But our team trains the parents in not accommodating, in not over reassuring, because there's always this line, especially with, teenagers in school avoidance or children in school avoidance is like, well, what if this is the time that they actually are sick? What if this is the day that they really can't handle it? And so we teach parents a structure of learning when to push, when to pull
Hmm.
back, when to let them fail, quote unquote, when to let them try. And so that's a really structured short-term treatment that our clinicians work on with the parent while the teen is in therapy, because you could resolve trauma, reduce anxiety, increase skills in teens. But if a parent goes, you don't have to go today, I'm not up for the fight, then of
Yeah.
course, why would they go?
Right.
So we have to work on the parent side of things too.
I love that. And I'm sure that's one of the benefits of having a team is that you can, they can do it at the same time the parents are doing something, the like child is
Yeah.
doing something. That's awesome.
It's one of the things I love about the work that I do is that I get to do it with a team that's excited about all the same things that I am. So I'm very grateful for that and that we have each other to really work together. I mean, a lot of the cases that we work on are very high risk, high acuity, high stress, and doing that work alone would be a challenge.
Yeah, absolutely. That's awesome. What does we talked about like the intensive itself, we talked about like screening and intake.
Mhm.
What about like reassessment or like discharge? Do people tend to just come for the intensive itself and then they're like, see you later? Or is it ongoing? Like what does that typically look like for you?
Sometimes they just say see you later, but most times they don't. What I have found, and I do almost exclusively accelerated resolution therapy and or assessment work. I'll keep like I'm a DBT trained therapist, so I'll keep like one DBT client in the mix. But because of all the things I do and because I oversee and lead and manage the whole team, I tend to not really enjoy doing ongoing work. And so this is coming back to your question, I promise. But
Yeah, yeah.
and so a lot of times I will do that assessment and ART piece because I really enjoy staying connected clinically, but my line is like I can't have something ongoing on my calendar. And so by the end of an ART like period of sessions or intensive period, clients will be like, you know what, I feel better about this, but I also have everyday stressors or friendship
Hmm.
stuff or like my everyday depression that I want to deal with. And so
Yeah.
then we're referring to another therapist in-house who will see them on a weekly basis or, biweekly, whatever makes sense for them. So most times once we get a client in the door, they stay with us for a while, average like 6 months. But yeah, they typically then like uncover these other pieces that they just want to talk through or work through with one of the other models that we use at my center.
Hmm. Hmm. That's awesome. Is there anything that I haven't asked you about yet that you feel like is kind of like an important piece of the puzzle?
Let me think through it. So I'm going to talk you through a process and you tell me if it's redundant or if it makes
No,
sense.
I love it.
But so, okay, we start with our clients will do a cross-cutting screener, and that gives it's basically like 1 to 2 questions in each area that we work clinically, like depression, anxiety, OCD, trauma, eating disorders. And that gives us an idea of what we want to screen further for. So they're doing that before they come in for their intake session. Then
Okay.
in our intake session, we ask all of our biopsychosocial questions, but we also, if anything's like dinged positive on that crosscutter, we'll say, oh, I noticed that you have trouble sleeping, or I noticed that you
Mhm.
have a lot of self-critical thoughts. Like that came up on the screener. Tell me more about that. So we're using that to guide our assessment. And then at the end of that assessment, we're sending out further screeners based on what our targets are that we're going to work on. So it could be depression, anxiety, panic, trauma, social anxiety. So that for the intensive purposes, those are the ones that we use. Then
Yeah.
we're having our ART session. And then 3 days later, we send out that screener again and we get a sense of what their scores are.
Ooh.
Usually, we have another session on the books already,
Hmm.
if not by that third day, if we're doing the every other day model. But sometimes clients come in and they're like, I want to see how this goes. I want to see if this worked before I decide to come back and do it.
Sure, yeah.
So in those cases, I'm reaching out and I'm saying like, hey, your trauma PCL's dropped by 33 points or whatever.
Right.
This really worked. And I'm noticing that maybe there's this like other little piece with your anxiety that maybe you want to come in and work on. And then we're getting them
Hmm.
back in. And so each session, then we're using those screeners. So I might say, like, oh, it's like your GAD says that you're really revved up every day, or that
Hmm.
your thoughts are spinning all the time. What does that look like? So I'm using those questions as the launch pad for then assessing what our next target is going to be. Because what I have found, and it might just be my experience, is that the clients that come in need guidance on what is the actual target, like that, not the tip of the iceberg thing that I see every day, but the thing that I need to work on that's actually going to get me to my goal of getting
Yeah.
back to school. And so that is what our typical process looks like until we've hit that goal of the client getting back to school. There might still be things that they want to work on, and then we're referring to ongoing therapy, but that's typically what the process looks like. There's one other thing that I didn't mention. There is this part in ART where they call it a scene match. I think are you an EMDR therapist?
Yeah.
In EMDR, I think they call it like a float back
Oh
or a
yeah.
touchstone
Uh-huh.
memory.
Yep.
Okay. So there might be times that a client comes in and they have no idea why they're not going to school. And so we can use the client's body sensations as kind of like a bridge to helping us uncover what that root was of why they're not going to school. And that could be
Yeah.
surprising for some clients, like just learning what it was that started it.
Hmm.
Um, Typically we're trying to uncover, when did you first stop going to school? When was the worst day of school avoidance? When was the most recent time you avoided school? And we're looking for patterns throughout all those things. But if we can't find any, the scene match or that float back can be a really helpful way to guide us into, maybe it's something that you're not even aware of right now.
Right. Oh my gosh, I love that. Because yeah, if people think like, well, I don't even know what the problem is, it's not that obvious,
Right,
that can feel really scary or frustrating for them too.
right, exactly.
That's great. Yeah. I I think this is so helpful. It's so practical. Um, it's neat to see it within a group practice where there's like therapists collaborating and supporting each other.
Yeah.
Um, there's just so many great things about it.
Thank you. I'll say the other piece that we add on top of that that we didn't talk about is that we do have groups for our anxious avoiders, and that's
Uh-huh.
not in the intensive part, but they can join that to learn more skills about acting within their values, like approaching things that make them anxious, having
Hmm.
social support and accountability while they do that. And so that is another just like piece that we can stack on top. So a lot of what I like to talk about in my practice is like these service stacks. And it's not one size fits all. It's not that someone comes in and this is exactly what you get. It's like almost like custom made for
Mm.
what are you coming in with? And then what services can we stack so that you have skills group support, so that you have clinical support, so that your parent has support, like all of
Hmm.
those pieces come together. And I think that's part of what makes it so different than just like a once a week outpatient setting.
Yeah, yeah, absolutely. And then how you use the screeners and the data is also really powerful. I think when clients and even us, when we can see the physical numbers, it's so validating. Like, yeah, it does feel that bad, or like, yeah, it got so much better.
Right.
Love that.
Also, if you're thinking about like, I'm going to say parents specifically here, when they're bringing
Right.
their kids and they're saying nothing is working. And so I'm
Hmm.
saying something is working. Look at these numbers, like we're moving in the right direction, and it generates hope. It helps them keep going because it can feel like if your kid hasn't gone to school in 10 days, it can feel very all or nothing. Like you're
Hmm.
not seeing in that moment. well, today they got out of bed and yesterday they didn't even answer you when you knocked on their door. Like these micro moments of progress are happening, but it's so hard to see. So I think showing them, we show them the visual of the graph of like things
Mhm.
going down. And so then they're like, oh, wow, like this is doing something. Let's keep going.
Yeah, yeah. Oh, I love it. Let me
Hmm.
see, folks who are here live, do you have any other questions or things that you're curious about? I'm just reading this last one. We talked about the schedule. We talked a little bit about the setup. Since I'm not ART trained, is there anything um, specific that an ART therapist watching this might might be curious about?
Hmm. I mean, I think I covered some. I was looking to see if I had slides that I could show you some of. I think I covered a lot of it in terms of looking at how do we uncover the target. So first, what's the
Right.
most recent, maybe thinking about a scene match, and then really focused on if it's maybe a trauma, we're doing like a basic script. If it's not, if it's anxiety or if it's panic, maybe we're doing a typical day, which might not mean anything to a non-ART person,
No,
but
no, I'm tracking.
that
It
is
like translates pretty well.
yeah, that is what I'd consider self-pay or insurance cover sessions. We are self-pay and we give families super bills. And a lot of times when families come to us, they're in that place of desperation of like they've tried other routes that haven't been successful. And so it's an easy next step for them. What determines if ART versus traditional treatment route? Yeah, so it's really about what the targets are and how they'd want to work on them. So for a lot of our anxiety and trauma clients, ART is the route that we go because it's the most efficient way to help them feel better quickly. But for our clients who are self-harming, suicidal, high acuity, we always put them in a comprehensive DBT program. But we also weave in ART for those sessions as well to enhance what we're doing in DBT. And so it's not an easy like if this then that, if this then that. It's really doing we're big on assessment. We have a 4 to 6 week assessment period. And so it's really doing that assessment to figure out what does this particular client need based on the modalities that we offer.
Love that. And it's again so great to have a team that can offer all of those things. Awesome. Is there, let me check where we are on time. Oh, we still have a few minutes. Um, what about the assessment side of things? If you're going the other route, are there any other kind of like processes or details that you can let us in on that side?
Yeah, well, so I love our assessment process in general, and I can tell you all about it. So we do our biopsychosocial assessment. We do something called our identifying problems session, and this looks different depending on what the modality is. If you're a DBT therapist, it's building a hierarchy. Maybe that's also the case if you do anxiety work. But this is really just looking at behaviorally, what does your presenting concern look like? How frequently are you not attending school? We'll stick with this. What's the intensity of your meltdowns in the morning? And so we're really getting, because again, we want that baseline data so that when we're doing
Mhm.
work, we know what's improving. So we spend a full session getting really behaviorally specific and operationalizing what is the concern I'm coming in with and what does that look like? Duration, intensity, frequency, topography, like what am I seeing? And then we do a goal setting session, and that's another whole session that we work on in our assessment process. And this looks, I mean, it's a goal setting session, but we work with teens. So it could be creating a collage, it could be going outside and doing sidewalk chalk, it could be whatever, but we're very creative and meeting the client in what's going to be most engaging for them. We also use like interactive cards, if you've ever heard of them.
Mm,
They're
yeah.
they're made for IFS, but the visuals are really powerful for our teens. So we use a lot of methods to get really clear on what does life look like when you're not experiencing this problem.
Ooh.
And then we move into developing a treatment plan and we involve parents in the treatment plan process. So we'll say, here's what Claire is experiencing, here's what she wants to move towards, here's initial plan for modalities, frequency of treatment, specialists on our team that we think that would be a match for you to reach those goals. And also we do a parent intake where we're getting a sense of what is the parent experiencing, what is their everyday life look like parenting a child with mental health
Mm.
concerns or the behavioral concerns that they have? And then what are they doing that's getting in the way of the teen being successful? And what treatment or skills group or recommendation is going to be a good fit for them so that they're supporting treatment rather than unintentionally interfering with treatment. So then we put
Yeah.
all those pieces together in a treatment plan, and we get everyone to agree to the treatment plan before we move forward. There's another little layer in that process. If we notice that they screen positive on any kind of ADHD screener, or we're getting a sense of sensory experience being a challenge for them, then we do ADHD testing at my practice, and we do something called sensory profile, which you can purchase and do. It's basically like getting a sense of how you experience the world through your senses, and
Mm.
it spits out different accommodations based on your sensory profile. So we do those two pieces as well, and then support the family in advocating for any kind of school supports that are aligned with what their ADHD and sensory experiences are, if that's a like a part of their whole profile.
Yeah, so incredible. Oh my gosh. I can just see that being a game changer too, to be like deeper understanding of yourself, deeper or your child, and
Right.
then being able to make shifts to the school environment that make it more supportive, more accessible.
Exactly. It's just how my brain works. And I see Jess's question. I want to answer that too. But like side note about me and then back to the work is that I'm 42 and I'm going through this experience of figuring out like how my body is changing. And I went to a doctor and they were like, take this pill. It'll either make things way better or it'll make things way worse. And we have no
No.
idea which one until you take it. And it makes it boggles my mind. Like, how can that be true? How can you not take like levels of things in my blood or my thyroid or whatever? Like, you have to have better assessment processes. And so that's my illustration for why I think assessment is such an important part of any kind of like health, holistic health work is like you can't just say try this and see if it makes it better or worse and then let me know in 6 to 8 weeks. Like
Right.
that's not going to fly for me. So assessment is really important and it's something that we really drill home for my team and families tend to appreciate that. Because there have been other places where they've been given a list of coping skills in the first couple sessions and been like, this is what we do. Like it's just
Right.
really important to me that we do it differently.
Right. And it communicates you are complex and we're going to come up with a really like a specific solution for you, not
Exactly.
just a cookie cutter
Exactly.
list. Yeah, that's
Right.
really empowering.
Agreed. And then Jess asked, do we see adults, non-parents, or exclusively teens? We see adults for ART. We have pretty specific tracks at my center. We have our comprehensive DBT program. I'm Linehan board certified, and that's like the majority of our practice is a DBT practice. We have a track that is anxiety OCD, and that's led by another team member. And then we have our everyone's trained in ART. And so I'm really careful with who we accept into the practice to work with because I want it to be in these areas where we do our best work. So we don't have adult DBT groups, so we don't accept adults into our DBT program, but ART is it's a treatment that it works for like all ages. And so the process is the same no matter what age you are. So my team is competent in seeing adults in that part of our practice.
Mm-hmm. Love that. It looks like Claudia's wondering, can you say the name of the sensory assessment again?
Yeah, it's called a sensory profile.
Sensory.
I think it's if you can get it through Pearson, like the Pearson screeners or assessments or whatever.
Yeah,
If you Google sensory profile, that's what it's called.
cool.
It's like I think it's 60 questions and a Likert scale, and then it gives you your sensory profile. For example, like high sensory sensitivity, high sensory avoidance, low registration, sensation seeking, I think is the other one. And then it'll tell you what your level is in each of them and what accommodations are helpful in each of them.
Awesome. Love that. Yeah, thanks. Um, age range, just within
Yeah,
your practice, what does that look like?
12 to 26 is our typical, like, well,
Hmm.
except for our DBT programs, and then all ages 12 and up for our ART program. ADHD testing, we can do 13 to 60 only because the test that we do has a cutoff at age 60. And so that's where we cut it off because we have to. But yeah, so DBT 12 to 26, everything else, we'll see all ages as long as it's an area where we can provide support.
Yeah. Oh, I love it. Any final questions, people who are here live? I just want to say thank you. It's so great to
Thank
hear
you.
um like what your team is doing and how you're doing it. And I just appreciate you letting us into your world. It's really cool.
Thank you. I have final thoughts. Am I allowed to do final
Yes,
thoughts?
yes, absolutely. And
Okay.
tell us how people can stay in touch with you, all that good stuff. And I'll make sure to post all your links as well when this goes live.
Awesome. Yeah. So my final thoughts about school avoidance and doing intensives is that, and people have reached out to me and they want to get really tactical. Like, what exactly do you do? A, B, C, D, E, F, G, whatever. And so I really want to encourage, which I'm sure you do too, Steffeny, like use the modalities that you have and think about how you can solve the problems of your client base or your students with the modalities that you're using. Um, and just like try it out and iterate it because that's what I'm still doing. Like you heard me say, we're doing 90 minutes. We've done it this way. We've done it this way. Just like start helping people and see where it goes. I think that
Mhm.
when we get too locked into the mechanics of something, it kind of like hinders us from being able to just get out there and start helping people. And in terms of where to find me, so my therapy practice is in the Philadelphia area. We're licensed in Pennsylvania and can see telehealth in Florida, creativehealingphilly.com. Also, if you're interested in any kind of consulting, my therapist consulting website is visionarytherapist.com.
Cool. Oh my gosh, thank you so
Thanks
much.
for having me.
It was awesome. We're gonna post this out and I'll just tag you in there in case people have, if you're catching the recording, tag one of us and we'll keep the conversation going. But appreciate you so much, Katie.
Thanks for
Thank
inviting me in. I love
you.
this. Bye,
It's so
everyone.
fun. All right, have a good one, everybody. Bye.
Bye.